And I am muted. Hello. Hi. Welcome to Revealed. I am Dr. KP, your host and your friend. This is the third Friday of the month, so Revealed is happening now. If you don't know what Revealed is a show where you share your plastic surgery journey. We go over the highs, the lows, the lessons learned, and the would you do it again. Really just to educate, to empathize, and to understand what it's like to go through plastic surgery. And if you are planning to have a plastic surgery yourself in the future, hopefully it gives you some insight and helps you make a more informed decision. I'm excited for today's show. Normally there are 3 ways that you can be a part of the show itself, and actually 4. So one is that you can actually join the live, and I'll put the link in the chat. You can actually come on the live and share your own story of what happened. You can also leave a comment in the chat and leave a comment after the live is over. We love a good comment, and I do mean a good comment. This show is about uplifting. It's not about bashing people, places, or things. So if you cannot uplift, then shift. And then lastly, you can always like and subscribe, and subscribe even more. All right. So I'm excited about today's show. I think we have a few good guests coming on. And without further ado, hi there.
Hi.
Welcome to the show.
Thank you for having me.
Oh no, my pleasure. Thank you for joining us and being able to share your story with us. So the first question that I always ask everyone is, what have you had done?
I had a bilateral breast reduction and lift.
Okay. And was your surgeon a board certified plastic surgeon?
Yes.
Beautiful. And what was your original motivation?
So I grew up heavy chested. And I'm not that tall. I'm 5'2", so I'm real petite, and I always just had a big chest. As I got older, it caused me like a lot of back pain. I had grooves in my shoulders and different things like that. And overall, it just led me to be uncomfortable.
Yeah.
So that's what led me to wanting to get a breast reduction. I had talked about it growing probably since like in high school, like, oh, I'm going to get one. And then the closer I got to 25, I was like, I think I should just go ahead and get one.
Yeah. Can I ask you a question that that should have come up before for you as well? But have you had children yet?
No, ma'am.
Are you planning to have children?
No, ma'am.
Okay. So the reason I ask is, there's always the possibility of breastfeeding after children, what that looks like after a breast reduction, and that can be affected. The other thing is that sometimes people feel like they delay until they have the kids and their breast changed to have a breast reduction. But as you said, it can cause you a lot of pain over the years. And so there's really no reason to wait until kind of that far off day that you might have children or you plan to have children. You should just do it because you're having pain, and living like that for years is horrible. About how much did you pay for this?
So insurance covered the majority of it, but out of pocket, I paid $1,500.
Perfect. And that is very true. So insurance, as long as they see certain criteria, will pay for a breast reduction. Um, what were your expectations going in?
Um, I didn't really have, I guess, too many expectations. I knew that I wanted to go down a smaller size because I was at H, and
Mm,
so I was like, anything lower than that, I I am perfectly okay with. But when the surgeon came in, um, he like measured and said that he would probably take more out of one than the other, different things like that. Because if he was like, if it is going to get covered by insurance, there are a certain amount I have to take out. So he just explained that to me, and I was like, that's fine. Anything's better than what I have going on now. So
right.
I was good with it.
Understood. Understood. Um, without naming your surgeon, can you just describe your interactions with him overall?
Um, the interactions, they weren't bad. He's an older gentleman, and so his I would say I had more interactions with his nurses
Mm-hmm.
than him, but he went over everything, asked me if I had any questions. Um, I told him no. I saw him during my consultation. After my insurance approved it, I came back probably like 2 weeks before my surgery for my pre-op appointment. I saw one of his nurses. They walked me through how everything would go. And then I saw him again the morning of surgery when he took my measurements again. And then he drew stuff on me. And then he was like, okay, well, we'll see you in the OR.
It, so when you say not bad, it doesn't sound like you had like this really warm feeling leaving him. And not every surgeon is going to make you feel that way. But would you say that the relationship that you had with him, or kind of the way that he came across, was what you needed at the time, or would you have wanted a little bit more?
I just would have said I wanted a little bit more. Like, I mean, and again, he wasn't like rude or anything, but again, his nurses were they were friendlier. They were just
Mm-hmm.
more like, But I mean, he was very professional and everything like that, but probably just a little bit warmer, if anything.
Mm. Yeah, no, I think that's fair. I think that's fair. I think I often say that having a surgery is one of the most vulnerable times in people's lives, and I think that at those times, most people I think would appreciate someone who's a little bit gentler, a little bit softer, and so, but that's not every surgeon, so we can't have that expectation of them. But I think it's fair to say that you wanted a little bit more from him. Overall, and I didn't ask you, how long has it been since your surgery?
It's been 3 weeks. It's been around 3 weeks.
Oh,
I just had
okay.
so it's
So
been
you're really fresh.
yes.
Okay. Okay. So far, have your expectations been met?
Yes, they have been. I'm very excited. I don't have a lot of back pain and different things like that anymore. And I'm still kind of sore, but it's definitely, the pain was definitely better than what I thought it would be going
Oh,
into.
good. Good. Very good. Very good. What do your friends and family think about what you had done?
Um, they're really supportive. My mom actually flew down to take care of me for the first week and was there with me through it all. So like they were very supportive. They all say it's just so different. I guess how I look now. They're like, oh wow, like. But everybody's been very supportive, and I've even had some of my friends be like, "Oh well, I'm going to save my money up because I need to go now. I need to go next." So
Mm,
everybody's been really supportive about it.
good. Good. Do you think you would do it again?
I would.
Good. And if your daughter asked you to have the same procedure when she's older, I know you're not planning on having kids, but if she were to ask you, what would you tell her, or what would be kind of your words of wisdom to her?
I would tell her, depending on what age she is, I would tell her just like think it over, weigh the pros, weigh the cons, and if that's something that you want to do, make sure that you're doing it because that's what you want to do, not because you want people to perceive you a certain way, or not because of what you've seen in social media or different things like that, but do that because that's something that you want to do. Because at the end of the day, you have to live with your body no matter what you do. So just be confident in your decision.
Yeah, exactly. So far, have you had any complications?
Um, no, ma'am, not really. I think like the T junction, that
Mm-hmm.
part right there, that's probably caused me the most, because I was like, oh my goodness, it's still like, it was still kind of open. So that was the only thing that kind of like scared me. And so then I was calling the nurses, but they assured me and everything like that. So that's been the only thing.
That's fair. So the T junction, for those of you who don't know, I'm going to use the palm of my hand. So typically, a breast reduction involves 3 incisions, one around the areola, if you imagine this is the areola, one straight down, and then one that hides in the fold. What we call the T junction is right at the bottom of the breast, where those two major incisions come together. And that usually is the most vulnerable part of the breast reduction. It's where there's the most tension, and also it's where there's the least amount of blood supply. And so, depending on how large you were to begin with, that can actually be a prime area for a wound after about 2 to 3 weeks. So it is normal to see that, and people should not be worried about it. What concerns or anxieties did you have so far, or have you had throughout the process?
Um, I would say that like my biggest thing, this was my first major surgery or having to ever be put under anesthesia or anything like that. So I was really
Mm-hmm.
scared like about the pain more than
Mm-hmm.
anything. Um, and different things like that. And just, I'm a very active person. So when they told me that I couldn't run like usual and I couldn't lift over 5 and 10 pounds, that was like the thing that kind of, I was like, about. But the pain was better than I expected. Probably after day 4, I didn't have to take any of the prescribed pain pills or anything like that. So that's been, that was one of them. And just me just walking now instead of doing my usual exercise, that's been one of the things that I'm just like,
Well, you have 3 more weeks as long as everything goes well. 3 more weeks of that, and then you can go back to kind of normal stuff.
yes.
Um, Another question for you: what have you learned from all of this so far?
um I guess to be kinder to myself and just take it
Mm-hmm.
easy. I'm a busybody,
Mm-hmm.
so this has really gotten me to just slow down and really just, I guess, just be in the moment of things, but also realize
Mm-hmm.
it's okay to not always be going, and just giving my body time to rest, and just being kinder to myself and realizing what I put in my body, because I know that it's important so that I do heal properly. So just making sure that I'm getting the proper nutrition and things like that.
What were you told about what's the proper nutrition after surgery?
They told me to eat like things high in protein. They said that if I did smoke, don't smoke. I don't smoke, so I didn't have to worry about that. Make sure I stay hydrated, and just making sure that I'm putting good things in my body so my body can heal properly, and so it can heal at a quicker rate than, like me eating like junk food or putting just things in my body that wouldn't benefit it, since I have had a major surgery.
Yeah, I agree with all that. Things high in proteins. Smoking is an absolute no. It's not just bad for potential lung cancer in the future and other possible lung complications, but it's also horrible for wound healing. And so smoking tobacco is the number one thing that makes me stop in my tracks and say, no, I will not do surgery until you stop smoking. Um, Typically, I say 6 weeks before and 6 weeks after surgery, you have to refrain from all tobacco use. Things like marijuana, I'm not a stickler for, but nicotine is horrible, horrible for wound healing. And then last question, do you think plastic surgery is addictive?
I think that maybe it can be addictive depending on the person. Like I had said earlier, making sure that you do things for the right reason, um, and then making sure that you do them because that's what you want to do. I'm not against plastic surgery at all, because it has made my life so much easier. But I think depending on how people look at things and their outlook just on life and things in general, it can be addictive to some, because some people might be trying to chase this image of what they perceive beauty to be, or what the world or social media is putting it out there to be. But I feel that, you have to realize that you're beautiful or handsome and things like that. And it starts just liking and loving who you are, not chasing what other people say is that, and being comfortable in that. And if it takes plastic surgery for people to achieve that, then that's their that's for them to decide. But I I think that there's definitely good in plastic surgery.
Well, thank you. As a plastic surgeon, I love that. I think there is too. I actually have a little bit of a follow-up question.
Mhm.
Did you know that breast reduction was considered plastic surgery?
Yes, ma'am. Because when
Okay.
I had to look it up in my insurance, I had to actually go under plastic surgeons to find it.
Perfect. Perfect. Well, thank you very much for joining us. I hope you have a good rest of your night.
Thank you, Dr. KP. Have a great day.
You too. Well, that was beautiful. So breast reduction, I think a lot of people, Rachel was more informed than I think a lot of people are, because most people, I think when they come to the plastic surgeon's office, don't necessarily realize that breast reduction, which is considered part of insurance coverage, is something that can be done, one, and then two, that a plastic surgeon is the one that does it. And this actually might be breast reduction night, because I have another young lady who also had a breast reduction, and I want her to discuss her experience. Guys, feel free to comment, share your thoughts, share your questions. I will ask them if they're appropriate, obviously. And let's get to that. Can you guys hear the interview? Can you put in the comments if you can't hear it? I'm going to keep playing it. So I'm hearing that you can't hear. Let's see if we can fix this, because I think Chase had some nice things to say about her experience. All right, I'm just gonna try this again. Oh, here, let's try this. Okay. All righty. Thanks you for joining me. Can you hear it now? We have Chase here who's going to give us her story. So without further ado, let's just get into it. So Chase, what have you had done?
I had a breast reduction and lift done.
Awesome. How long has it been, just for reference?
It has been about a little over 4 weeks. I had it done on May 20th.
Oh wow. So you're still in the journey.
Yeah, still kind of like fresh with everything.
Yeah. Was your plastic surgeon a board certified plastic surgeon?
Yes.
And then without kind of giving too much detail that would reveal who they are, describe kind of your interactions with them, your impressions of them.
So I was already going to like the office, sort of say, just for Botox. I seen that they offered a lot of different cosmetic surgeries, and I was always interested in a breast reduction. I just was a little nervous to like always pull the trigger on it, but just being comfortable within the office, like going in for Botox and just kind of meeting all of the people there throughout that experience, I felt safe, sort of say, with like them and the people around there. So then I asked them just like, hey, what is the process look like? What does recovery look like? And they were just so open and just like excited when they were talking to me about it. And that made me feel excited, like, okay, like this isn't a scary process. Like these people look like happy to kind of talk to me about it. And that just kind of made me feel like more comforted about it. And then I asked it, like I was talking to them, and then I went ahead and booked a consultation, which was just more in depth, where they could actually kind of just like see my chest and do measurements and talk to me more about like realistic results and what they recommend for sizing and options. And even with that, like I had a bunch of questions in my head already, but during the consultation, he addressed every single question I had without even me like asking it. So again, that kind of just made me feel more secure, because it was like, okay, he knows what he's doing. He knows what to say. He knows what already like people have questions about. So he's already answering that before I even have the like chance to ask the question. So that made me feel like, okay, he kind of knows what he's doing. Like I trust him a bit. And then after the consultation, they also were very like good with the whole like waiting process, I guess, like to see if I wanted to book the surgery or not. I'm not the biggest fan of people who always like calling my phone, like trying to get me to book something or trying to get me to do something. Cause then it kind of just makes me feel like they're in it more so for like maybe the financial reasons or like just not the reasons that I want. So honestly, when I didn't really get a call from them, like to see if I wanted to book the surgery or something, that made me feel like, you know, they're really just waiting for me and like on my time to make the decision to see if I wanted to do that. So I really did appreciate that from them. And then, you know, after talking to my mom about it and just figuring out all the logistic stuffs for me, I decided just to reach back out to them and say I wanted to move forward with the surgery. And again, the whole process with them was just so simple, so straightforward. They always just let me know everything that was going on. And they were always just like at my side 24/7 if I had any questions or concerns leading up to the surgery. So it was a really good experience.
Awesome.
Yeah.
What were your original motivations for getting the surgery?
So I am a very active person. In high school, I was used to do soccer and I used to dance competitively. So I was always moving my body in different ways. And I did have a bigger chest than I felt like my body was. It just was very unproportioned. And it was always very like restricting. I couldn't do certain things, or even if I did, like I had to wear at least like 3 to 4 sports bras, or just kind of make sure that everything was really strapped down. And then doing physical activities with like 3 sports bras on tightened up my chest, like it just made breathing worse. And it just wasn't fun. I now am out of high school, obviously, and just doing simple things like going to the gym or even like Pilates. Like I can't wear a cute like Pilates top without everything spilling out. And it just isn't ideal for me. Also, I do work like in church with our kids ministry, and it's just hard because I feel like anything I wear isn't necessarily like modest, because my chest was just kind of like poking out in everybody's faces, and I just wasn't a fan of that. So I just wanted a more like modest look for myself, and I also didn't want to live the rest of my 20s with like restrictions on what I can and can't do physically based on my comfort. So that was like one of the biggest things for me on why I decided to get the surgery.
Totally understood. And I think a lot of women can relate to that. Even I'm not a huge person, but I feel like my breasts could be a little bit smaller and I'd feel a little bit more comfortable sometimes, depending on the
Yeah.
tops that I wear. How much did you end up paying?
I paid $10,700.
Okay. Okay. And did you look at other surgeons, or you went with the surgeon you felt comfortable with right away, and so no need to look at other people?
So the surgeon that I had, I felt 100% comfortable with, and in my head, they were always going to be my number one. But I was paying out of pocket. Insurance was not going to cover it for me, so I decided I might as well just peep and see other options just to see if there is like a
Yeah.
cheaper option and if I could potentially feel comfortable with that surgeon. And I did find like 3 other places that looked like I could be comfortable with them or looked promising, but the prices were higher. So to me, it just wasn't worth it. I was like, okay, I have someone that I really like and they are the cheapest option, which
Right.
maybe like cheap isn't the way to go. But because I was comfortable with them, I decided like
Yeah.
it's a good fit for me.
Understood.
Mhm.
And thank you for bringing that up. So breast reduction can be covered by insurance. Insurance wants to see certain criteria are met. And those things include things like pain, back pain, neck pain for years, even breast pain at times, rashes underneath the breast. So a constellation of things that make it harder for a woman to live with, very large breasts. But there are those patients like you who are bigger than you want to be, bigger than make you comfortable, but don't quite cause kind of the somatic or the pain complaints that we can see sometimes. And so for those patients, you would have to pay out of pocket. So that's a good highlight there. What were your expectations going in?
My expectations going in, I never had a surgery before where I had big like incisions or stitches or anything.
Yeah.
So honestly, I had unrealistic expectations in my
Okay.
head. I just thought that they were just going to kind of like, do the cuts, do what the surgery needed to be done, sew me
Yeah.
up after, and then I would just be like in bed resting for like about a week and then back on my feet and back to normal life and I could like do everything that I needed to do.
Okay.
Obviously, that wasn't the case. I was
Okay.
I was down longer than normal.
Okay.
So yeah, I think the expectations that I had was just that I'd be back on my feet before I actually was back on my feet.
Yeah. How long did it take you to kind of get back to feeling normal again?
I would say 2 weeks, like a max of 2 weeks. That's the amount of time I took off from work when I originally only requested a week off, but I ended up taking 2 weeks off, and then 2 weeks I was able to do normal life again. Everything was normal. There obviously I was still like walking a little bit slow and just like I couldn't reach up on higher shelves, but I
Yeah.
still was attempting to do those things and like attempting to put myself out there, whereas before I was just 2 weeks like in my house not really doing anything.
Fair. And I think that's reasonable. So I typically say that for breast reduction, even though full recovery from any surgery is 6 weeks for you to get to feel completely back to normal. But I'd say for breast reduction, it's about 2 weeks where you feel like I'm still not ready to kind of see people go out and do all these things. But we do recommend that you stay as active as you can, even if you're inside the house, walking around, trying to, maintain for yourself, bathing, things like that.
Yeah, for sure.
What do your friends and family think about what you've had done?
My friends were questionable about it. They just didn't. I mean, I have, I guess, like 2 set of friends. Obviously, like, I have guy friends and then I have girlfriends. A lot of the girlfriends are very like understanding, like they kind of understood what I was
Yeah.
doing and they were happy for me. The guy
Yeah.
friends were more so like, why kind of are you doing that? What, that doesn't make sense.
Right.
And a lot of them too, a majority of my friends are Christian. So
Yeah.
some of them had the standpoint where like, this is the body that the Lord gave you. You shouldn't
Mm.
necessarily like what's the word, change it in a sense.
Right.
Then there
Right.
were some people who were like, the Lord did give you this, but if it's causing an ailment to you and you are not comfortable with it, like I'm sure he will understand you,
Yeah.
undergoing the surgery. There are people like, and they gave me an example, like just because if you're sick doesn't mean that you shouldn't go see a doctor to heal that sickness or something like
Right.
that. So
Right.
they were just wanting to make sure that I understood fully what I was doing and
Yeah.
that I was doing it for the right reasons and that my heart was in the right place. they just kind of wanted the best for me and they wanted to understand what was going on. But a lot of them, well, all of them were supportive in the end of it. All of them were there for me through recovery. So I have no complaints about them.
Good.
Yeah.
I think that is a good question about, what would the Lord think about changing the body that you're in electively? There are things, and but then that brings up the question of, if a kid is born with cleft lip, that can be considered just cosmetic too, right?
Yeah.
I know we don't think of it that way, but plastic surgery brings up a lot of questions about our relationship to God, one.
Yeah.
And then two, if we have one, and then two, kind of what it means to change God's creation, essentially. Right. So I think that's a really, really deep point. It's a question I've never been able to answer.
Yeah.
But as a Catholic who, is religious, I do hope that what I'm doing is seen as helping people through their hard times, whether it's cosmetic or reconstructive.
Yeah, for sure.
Would you do it again? I know it's really soon to say this, but would you do it again?
Yeah, I would do it again. I think especially now seeing the recovery time and what it takes, I would do it again. At first, I was a bit hesitant because, again, I'm not the type of person to just be in my bed, like not being able to move, being cautious, like I just kind of do what I want kind of thing. So not expecting that and then seeing like my body not really functioning as normal, like I can't, just walk around the store as long as I would like, was a bit like, oh, I don't like this, like I'm not comfortable, but seeing like everything and how it played out, I would definitely do it again.
If your daughter one day asked you to have the same procedure done, would you encourage her, discourage her, or what would you tell her about it?
I would hear out her reasons. I think the same thing as like what my friends were saying, like as long as her heart is in the right place about it and her reasonings are logical and not going based off of influences from other people telling her that she needs to change this about herself or influences from like outer sources. It's something that she's felt within herself and something that she wants to do regardless of what people say because she feels as though it's right. I would encourage her to go about it.
Perfect. So I know that you've just had the one surgery. Are you thinking potentially of having another surgery in the future? Or is there something else that you'd want to address in the future, do you think?
As of right now, no. Like I said, I'm not a big like stitches and kind of like that kind of person. So that is I'm still getting used to that. And again, like this was the only thing that I considered like restricting to me. There's nothing really else that I consider like restrictive. So as of right now, no, but who's to say in the future that something might, after I have children, if I want to, change something else about myself. But as of right now, there's nothing.
Perfect. Any complications at all that you had?
I wouldn't necessarily say complications. Just one thing that I noticed and I did talk to my surgeon about was my left breast, the incision that was going down to like the anchor incision had a lot of like trauma, I would say. There was a lot of like scabbing and just bruising around that incision compared to the right breast. There was nothing on the incision. Like it was super duper clean. There was no scabbing, no trauma. So it was a little bit scary kind of seeing one look a little down bad and the other one was healing perfectly fine. So I just wanted to make sure that there was nothing that I did, but my surgeon just reassured me like that's just the way that it's deciding to heal. He did also suggest that because I am left-handed, I dominantly just do a lot of like moving with my left hand, and that could play a part of just like the movement and rubbing and all the things can play a part into why like there's a lot of scabbing and trauma going on with this one.
Yeah, exactly. I always tell patients the breasts heal as if they're on two different people. So do not expect that, if one breast looks perfect, if the other one will follow suit. They will do their own thing, heal their own way. And in the end, it really doesn't make a difference in the end, but it can be a little shocking at first to realize how you're going through it for sure.
Yeah.
Besides that, any other concerns or anxieties that you had during the process?
There was a lot of anxieties, I will say. I had a ton, but again, just because I've never, necessarily been cut open before or had stitches. And I think especially too, the placement of the stitches and just the fact that they are like your breast, you can like feel them, there's pressure. I was always just scared of like something popping open or potentially getting infected, or just the stitches not holding up. And especially too, like you're wearing a compression bra, so once you take that compression bra off to shower, the tension and the pressure feels so weird. It kind of feels like, you know, they're gonna fall off sometimes. Even with you not necessarily having feeling, because again, like you don't have feeling in certain areas, you don't have feeling in your areola or your nipples. And I used to have a lot of feeling to now not having any feeling or minimal feeling is anxiety inducing. And it's like, okay, why am I not feeling anything? Like I'm touching it. Why can't I feel that? That can be a kind of scary. Same thing, just like seeing the trauma and the scabbing and just the bruising, it's not fun to look at. So that can cause, you know, your mind to race on like, wait, like what did I just do? Is this like, is it gonna look like this forever? Like I'm nervous, I'm scared. And then the same thing, like the stitches, I was super duper anxious just to do anything, like even just to like lift my arms a little bit, because I didn't want to like tear open a stitch or rip it open or anything. I had a lot of anxieties, but it might just be because I'm a little bit like of an overdoer. So I was just like, I don't want to do anything to like hurt myself or do anything bad.
No, I think that's totally normal. I think a lot of people, whether they want to admit it or not, are very scared of them doing something wrong that causes everything that happened in surgery to somehow, you know, fall apart. And, you know, I'm always amazed by how the body is resilient and heals. And I think, you know, we used to have a philosophy of like, don't do anything, lay in bed for weeks. And then, you know, when everything is fully healed, then get up and move. And now now the philosophy has changed to be like, no, you can be active. You just can't, you know, you do have restrictions, but you can really try as much as you can to be active and really walk and move. And it helps the body heal even faster. So I think it's a normal concern that everyone has, but the body is truly, truly resilient. And, you know, people heal really well. And so it all works out. What have you learned from all of this?
I think I've learned just honestly more about myself. Like I said earlier, I didn't necessarily think I was going to be so nervous and so just like careful about everything. Again, like I'm the type of person where like I'm just always on the go. I don't really like give myself rest. I don't like lounge around in bed. So just kind of like having to be able to take that time to actually like rest and recover made me realize like I kind of need to do this more for myself, not just because of the surgery, just overall, like as a person, you need to give yourself rest, you need to give yourself grace. And even like with the healing process, just kind of being frustrated with myself that my body wasn't healing, or like that this breast looked a little bit more traumatic than this one and this one was healing better. And I was just frustrated with myself. I was like, what am I doing wrong? Like I'm doing everything the surgeon told me to do. And you know, they're healing slow. I was 2 weeks and I was like, why aren't my stitches closed up? Like, why is everything still like healing? And just like telling myself, like, I need to give myself grace again, like not just in this situation, but just in life. Like I can't be too hard on myself that my body's literally healing from a surgery. Like it's going to take time. But yeah, just overall that it's okay to rest and that I can take a rest. I'm owed a rest, and that it's okay to give myself grace. I'm not perfect. My body's going to heal on its own time. Everything's going to happen in its own time. And I, you know, can't control that. And I need to give myself grace for that.
No, I love that. I love that I don't think a lot of people, I don't think we are taught that, right? That it's okay to take a break and rest. I think we're always taught to be moving, be thinking, be growing our business, be doing this, be doing that. And that's how we burn out. And so it's really amazing that this process taught you that it is really okay to take a break and let your body kind of do what it needs to do, and that you can apply this to other parts of your life where previously you would have pushed the envelope and pushed yourself to complete all the tasks in one day and whatnot. But that really, truly, that we need to give ourselves a break and give ourselves some grace. I love that. I really do love that. Last question. Do you think plastic surgery is addictive?
I could definitely see how it would be. I will say, I think anything like plastic cosmetic can be addictive. I know I am a super duper big fan of Botox, so I am a consistent like Botoxed patient. I,
Mhm.
get it every 4 months, I would. Um, so that is like a little bit addictive to me. As like the more the surgery aspect, I can't see how it would be. I personally don't think that I'll be addicted to it just because I don't like all the like cutting and the stitches and all of that. But I know that there are some people who kind of like will like that because they want to be able to rest and recover and, do all the things. So I think it's like a 50-50.
Yeah. I actually lied because you brought up the Botox again, and I forgot about that initially.
Mhm.
A lot of people would look at you and say, "Oh my gosh, you're such a baby. Why would you need Botox?" What would you tell them?
I tell them that I am doing it to be preventative. I like the baby face I have. I kind of want to keep that as long as possible. So I am doing it to be preventative so that way I can kind of still look like this in my 30s, 40s. So that is my reasoning for doing it.
Perfect. And do
Mhm.
you like the Botox to the point where you can't move your eyebrows, or you still like the motion?
I like a little bit of movement, emotion, just not too much to the point where it's creating those lines and wrinkles.
Mhm.
So that is why I do just like a little bit, not too much.
And do you mind just sharing your age?
I'm 22.
Okay.
Yeah.
Awesome. Well, thank you so much. I'm sure there are a lot of people that are going to be helped by this. A lot of women have big breasts and want to figure out how to address them and want to figure out what it's like to go through this process. And a lot of women also are thinking about Botox and starting earlier and should we start earlier and why. So I think you're going to help a lot of people. Thank you very much.
Of course. Thank you for having me.
Thank you. Have a great night, okay?
Thank you. You too. Bye-bye.
What did you guys think? And the theme was not breast reduction night, but that's how it turned out to be. We had two lovely ladies. Thank you, Miss Rachel, and thank you, Miss Chase, again for sharing your stories. Both who are actually, I would say, still deep in the journey themselves. Being 3 and 4 weeks out of surgery is still in the thick of healing. So, especially thanks to them. And also, I think it highlights that journeys are easier or can be easier for some patients than others. So the fact that they were willing to come on here and share them while they're still in it, I really appreciate that. Any thoughts before we close up for the night? Thank you guys for joining us again. This is our third taping. I had a good week. We had three wonderful people come on and share their stories. If you haven't seen episode 2.5, it's in the videos on YouTube. And Zoe had an amazing story about her lipo 360 and BBL. So I would check that out. But yeah, I think this has been a fun Friday night. Hopefully you had fun too. Hopefully you learned some things. If you're planning a breast reduction in the future, hopefully Miss Chase and Miss Rachel gave you some good tips. All right. Well, again, join us here every third Friday of the month. I'll be here, 4 p.m. Pacific, 7 p.m. Eastern, 12 a.m. West Africa time. I hope you will too. And tell your friends, because I think it's a fun show. I think it's an informative show. And have a good rest of your weekend. Love you lots and bye for now, guys.